Time now for this week's Health Matters. PA Lynn Szabo in the studio, along with myself, Paul Critz, and Mike Thornton. And we're discussing one of those things this week that's, you don't like to think about it. But if you need it in your life or in your family, then you
really need it.
And you really need it, exactly.
And a lot of people here don't get it when they really need it.
Really. Okay, tell us about this. We've got hospice and palliative care on the docket for today.
So this is a request from Mike, so thanks. He wanted to talk about hospice. I guess there was a recent comment publicly.
Yeah, it was one of those things, as much as I hate to admit it, Roger Gitlin actually raised an issue which I thought was worthwhile and important, and he was saying at the Crescent City Council meeting last time that there is no hospice care available here in Del Norte County. I'm assuming that he was correct, but I don't know that.
Yeah, that's true. It's like halfway here, not effectively here yet, but kind of halfway. So we should define hospice. So that's a medical specialty that focuses on terminally ill people. And what they do is they strive to meet the emotional, spiritual, and then immediate physical needs, including treating pain and treating depression and anxiety. And the whole point actually is that the patient has to have less than 6 months to live, as defined by two physicians. Okay. So they're focusing on quality of life, and they're kind of not as concerned with the length of life. So at that point, if somebody has a catastrophic, they're facing a terminal illness, and two physicians believe they have less than 6 months to live, then the focus, and the patient agrees to it, then the focus becomes away from fighting the illness to making the best of one's time.
Right.
Okay. So services can also expand into the family. And I thought this was cool. One of the local hospices in Brookings actually does pet relocation and things like that.
Oh my gosh.
That's kind of a thing. And all of us who are like way into dogs understand that could be an important part of kind of letting go at the end of one's journey. So sometimes this even involves organizing a place for somebody to die. If somebody's on the street or they're in a situation where they can't stay, they have actual hospice buildings. For example, there's a famous one in San Francisco, Coming Home Hospice, just off like a block away from 18th and Castro, which was an old convent.
Oh, wow.
So it looks like a dorm, only more beautiful. And it's got all these little rooms off Central Hallway, and people just kind of make their passing in love and light and happiness and beauty.
Wow.
Yeah, it's amazing. There's also one in Humboldt County too.
One of your notes here is, it's interesting to me, services extend to family and can extend about a year after the patient
Yeah, about
dies?
a year after. So
Wow.
that would be grief counseling, is my guess. And probably I would not be surprised if they had some referrals they could make for like legally closing out somebody's estate and things like that.
Right.
Okay. Probably arranging funerals. That's kind of like, I don't know how to do that happily.
Yeah, exactly. That's
but if all of a sudden I was faced to, like forced in a situation to do that, it would be a steep learning curve, I guess. So there's another kind of similar, slightly overlapping kind of care, palliative care, which is available in Del Norte. Hopefully, the person that owns the business wants to make it more available in Del Norte. But palliative care, they act as a medical caretaker for people with serious illness who are not immediately terminal, and they want to continue treatment. Let's say they have a cancer diagnosis, they want to continue chemotherapy or radiation. They don't necessarily have less than 6 months to live. But they need somebody who can provide more specialized services in a more efficient way than any of the other doctors. So the family practice, the primary, the oncologist, whoever.
You were talking in code just a minute ago. What's the scene for or is that coming up? For palliative care, there's somebody here locally offering this.
Yeah, that's coming up.
Okay, all right,
He's
all right.
a great
I jumped.
guy,
Sorry.
and I can hardly wait to tell you about him.
Okay.
But these services for palliative care are more varied, and some of the care overlaps. The Venn diagram kind of connects, and they overlap.
Mm-hmm.
So, first of all, as like Mr. Gitlin asked or brought up, access to Del Norte hospice care is like zip.
Mm-hmm.
There's Hospice of Humboldt, and they take care of Humboldt County. There's Coastal Home Health and Hospice in Brookings, and they take care of Curry. And they offer like nurses and physical therapists, occupational therapists, speech therapists, and an end-of-life doula, which you know what a doula is?
It's like a midwife, right?
Yeah, it's kind of a birthing assistant.
Right.
So she is particularly in charge of being in tune with the mom, and not really necessarily the medical stuff. Of course, they have some medical knowledge.
What's an end-of-life doula do then?
They do the same thing for someone who's dying.
Oh my gosh.
Yeah, my guess is they help with the family, and they explain the process, and they say, yes, this looks alarming, but this is expected, and this is how we can make this person's transition easier.
Wow.
So that's a cool thing. And they have spiritual care providers, which are chaplains, kind of a vanishing breed, though. And they have an intent, and this is important to answer your question. They have an intent to move down to Del Norte, and they actually have a building near Rumiano Cheese, and they can't get it staffed.
Wow.
They're kind of stuck in bureaucracy.
In bureaucracy or
Both.
Or market? Okay.
Yeah, staffing is an issue and permits are an issue.
Huh.
And I got this from a nurse who's I work with at UHS, and she's been approached by them because she's kind of known to the community, has a lot of good talents, would be an excellent nurse in a situation like this, but they don't seem to be able to make it happen.
When we're talking about permits for something like this, who would be in charge of issuing that?
So you're thinking like permits, like I need a permit to build a house or something. I'm thinking of medical permits.
Like license.
Right. And so I think the complication is that they're going from state to state. And Oregon is slow, but California is glacial.
Yeah.
In getting stuff done. So, I think they have to. And part of the problem might be in order to get the medical permits, you have to demonstrate staffing. And in order to convince people to be staff, you have to show durability of the business effort. And so I kind of think that's what's going on.
Wow. So do you recall what context Roger Gitlin brought this issue up in?
He raised it. He was there doing public comment on a couple of different things. And then he finally got to this one. And if I remember correctly, it was that this wasn't available here. He made some comments about part of the reason why it was so difficult is that there had been corruption in the hospice industry in other areas of the state, primarily the Los Angeles area. And so somehow or another, that was preventing the...
Sorry, Lynn's doing sign language.
No. I say I'm just relating what he said.
Yes,
that's all I'm doing.
You're not crazy.
Yeah, and so so I mean that made me wonder: A, do we have these kind of services, and B, if we don't, why don't we? And I guess my next question with that is: this something that Sutter could or should do since they've got a lot of resources?
Yeah, they have a home health.
So first, when he was talking about what Gitlin was saying, and you look like you were incredulous, you did not buy the corruption in the industry.
Never heard it talked about.
Okay.
And the whole list of like millions of possibilities of what could be going on here, corruption is like at the last.
Okay,
He wasn't saying that the corruption was here. He was saying there were other in the industry.
And that's what I'm saying.
Yeah.
Never heard of it.
I wanted to address that.
Yeah.
Yeah. Never, ever. I mean, these people who are attracted, at least the medical people and the nursing people and the chaplains and social workers and all that, they are like, some of the most sainted people among us. And it might be that they don't know how to run a business because, their calling really is to sit at a bedside and not really do payroll. But I have never heard or seen or even read in the newspaper that corruption's a deal. So hard to understand.
And I've learned something too, because it's I always said palliative, and it's not. It's palliative.
Potato.
No. Palliative is spelled a certain way, and palliative is spelled a different way, and that's what's in here. So but thank you. So I didn't know that. I was walking around sounding like a jerk.
Yeah.
Thanks a lot.
Well, anyway, so
all the high-level people involved in that type of care were all giving you the side eye.
They were there. Oh, here comes that. Okay. So I'm sorry. Back to it.
And the reason I know it's palliative care is because I used to be Michael Fratkin's PA around Y2K, and Michael Fratkin started Resolution Care. He's a physician. Is a graduate of OHSU, if that matters, is extremely brilliant, as one of the most compassionate people I've ever met in my life, and kind of amazing considering, the high level of medical training he had that didn't, destroy his spirit. So he comes to Humboldt County. He's working in Open Door. I'm his PA. He's much younger than I am, and I think they just, and I was older and had gray hair then, and I think it was kind of to keep him out of trouble. But he was always in good trouble, so I just helped him.
Oh, wow. Right.
So when he left the Open Door system, he bounced around. He was actually director of Hospice for a period of time, Hospice of Humboldt. Mm-hmm. And he got into this palliative care model and created a solution to a problem that wasn't being addressed, and so his solution was Resolution Care.
Okay.
So
what's the difference with Resolution Care then?
So what they do is they're working with people who are seriously ill, maybe terminal, maybe not terminal, and they are tending to all of the needs that the person has in kind of a supportive role with the primary care person. Okay. So, and what that means for a lot of people is they make a lot of practical everyday problem solving available. Like if somebody doesn't have a house, they get a house, they rent something. They address pain concerns. They address dual diagnoses, like if somebody's doing drugs and also has underlying mental illness, then they have meaningful resources to address that. And they used to have in the beginning a chaplain who was amazing. So he provides human-centered quality of life care. And so
what's the difference between what comes alongside or came before? Is it just the scope?
I think it's humanity.
Okay.
I think that he addresses what's most important to patients. So he was the one, and I've mentioned this before, who diagnosed somebody with spiritual poverty. So he addresses spiritual poverty.
All right.
And then he's able to, once he's addressing that need, he's able to address other problems that a person might have in their life as a result of that.
Okay, but is it just a matter of the Resolution Care addressing some of the same issues that Hospice or palliative care does, just in a different scope?
In a more humane way. But also, in a way different scope. For example, pain. Pain is a huge issue. Mm-hmm. So Michael's really comfortable managing pain with large doses of opioids in a more appropriate way because he's more trained to do that than, say, average family practice PA at UHS would be able to do.
Okay, all right.
And so that's a huge important thing to somebody if they're going to be trying to make this end of their life meaningful in some way, like reuniting with their family, mm-hmm. or not living under the bridge in Fortuna anymore, or stopping IV drug use, or making sure they get to their appointments on time or get their blood drawn, or so that's kind of a pivotal thing that he does. Mm-hmm. But he also makes him sound like a Dr. Feelgood, and he's not really. I mean, he definitely has boundaries and he keeps it safe, mm-hmm. okay? Mm-hmm. But he listens to where people are at more than the average provider is able to do because he has the resources to address what problems they
Okay,
have.
so
Does
just
that make
like
sense?
addressing that chapter in someone's life,
Right.
but addressing it with from the point of view of the individual's experience as
Really?
primary, as opposed to addressing these abstract issues that
Right.
might be okay.
A little more holistically, it sounds like as well. So I have a question, and I don't know how else to phrase it, but how many people in Del Norte would be in need of hospice services?
So
I mean, sooner or later, everybody, right?
in the last year that I've been helping Dr. Alsbury out on our educational sabbatical, I can think of two. And the problem is that it's not so much in the numbers; it's the deepness of need. Because when this comes down, this is huge, and it comes down really fast.
Sure.
And the system, as it grinds on at its glacial pace right now, it doesn't really have the ability to address things with the rapidity that somebody might be dying.
Yeah, I understand that we're talking quality versus quantity,
Right.
but there's also a quantity component of this. I mean, I guess what I'm trying to get at, what is the monthly death rate for Del Norters?
What's the demand here?
I guess that's what I'm trying
not to put it in economic terms.
Well,
but
right, yeah. I'm just trying because I don't know what just like we would. Somebody knows how many kids were born in Del Norte.
Yeah.
Somebody knows how many
I
people
don't
died.
really know what the death rate is, and people die in a lot of different situations. But we do get every Monday morning, I get a list of patients at UIHS who have died. And I would say maybe there's 4 or 5, and this is between 2 counties, remember?
Right.
And this is solely UIHS patients. I would say 4 or 5 a month. So, I think it's probably higher than that. If you assume that Del Norte Community Health Center has about the same, I don't know, maybe you're talking about 10 or 15 people a month. Mm-hmm. Now, some of those people die suddenly
Right.
and unexpectedly. And some of those people kind of have the slow slog, but I think there's definitely a need. And so Fratkin, going back to Resolution Care, Fratkin has 4 MDs now, 2 nurse practitioners, lots of nurses. Like, I think I stopped counting at 10.
And this is down in Humboldt?
This is between both. This is actually multiple counties. This is Trinity, Del Norte, Redding, and Shasta. Okay. He really wants to expand his presence in Del Norte. He calls me up about every 6 months and asks me how to do it. But he also, I should say locally, I really want to salute Nurse Kathy Mize, who is one of our local treasures and works at Resolution Care. And what I got told when I was advocating to get Resolution Care to take care of an actively dying person, so he would have qualified for hospice if we had it, is this was over Labor Day weekend, and I was talking to Michael on a Friday afternoon. He said by Tuesday I can have every one of his needs met.
Wow.
That never happens that fast. Never. And it's, I don't know, there's a reluctance in general to believe that it's helpful. So he's, people, I think it's because people, it's those humble people, and I don't know about this. I'm already a stressful situation. Why can't the primary care person just do it? And we really can't. So the amount of barriers to care for what an actively dying person needs makes it impossible to react as quickly as should happen.
Mm-hmm.
Oh, and I think there's probably a training and orientation kind of thing with most healthcare practitioners in that my job is to either fix you or so basically my job is to fix you somehow as compared to deal with you dying.
Yeah, so that's kind of vaguely in the background, but I'm talking about this person needs a bedside commode. How do you get a bedside commode on Medicare? Sorry, this would be Medicare most of the time. And it's like weeks of drama and paperwork and trying to justify and getting denied and then arguing again and then getting denied and then calling an 800 number so you can have a quote unquote peer-to-peer discussion about it, which is like why a commode? People pee and poop. They need one. They can't move fast. So, and this guy is like, has them. Like, okay, done. What else do you need? Mm-hmm. So it's really a nuts and bolts thing, but it's also a mindset and educational thing. So you're right about that. But he's amazing, and he actually helped somebody recently. I got some feedback about a UHS client who was cared for by Resolution Care, and it was amazing. It made all the difference. So I will give you their phone number. You can definitely, they're big into computer presence, so you could go to Resolution Care, Eureka, California, and find their website, which is, totally gorgeous. So, but their contact information is, their office is at 317 3rd Street in Eureka, and their phone number is 707-442-5683. And if there's an interest, I can definitely get Michael on the show to talk about his gig, because he really wants to be able to provide more services. And, he has access to a plane. He actually flies to people's homes sometime, like in Southern Humboldt.
Oh, my God.
And, Kathy Mize is like one of those frontier nurses. And, if somebody out in the sticks needs her, boom, done. She's not, not afraid to make it happen.
Yeah.
So really, really great resource. Could be a better solution than Curry's kind of nightmare thing going on. But they really are two distinct things, although they overlap a lot.
So, no, I'd love to have him on sometime and talk about this, especially if he's trying to establish a
His
presence.
compassion fills a room. He's
No, we're full up with compassion.
You think so? Yeah. Oh man, he would outdo you guys.
The waves of compassion
You just feel it,
from
yeah.
the KFUG studios.
What's that smell? That's compassion. It seems like you have a lot of experience, and I think it's perhaps you're kind of this sort of healthcare person too. A lot of experience with unique individuals who have the passion and the unique skill sets to address issues and to change things. Do you ever worry that all of these brilliant individuals out there aren't able to transfer their knowledge and expertise into some sort of bureaucratic, long-lasting sort of, like, we're not changing the system, we're standing on the shoulders of giants and letting the system kind of lumber on?
Yeah. And how many times have I charged up that hill and turned around and nobody was behind me?
Exactly.
Yeah, totally. And medical people who are the most compassionate, wonderful, inspiring people among us are like terrible business people. Redwood Urgent Care, that would be an example of that.
Right. You go back and listen to early episodes of Health Matters, the history of Health Matters, how it all began. But
amazing group of compassionate providers that really wanted to make a change and were like financially like lost in the forest. But anyway, But, one thing about Resolution Care is that Michael actually sold the business to some other big corporate entity that's more financially stable, and he did that so he could be more at the bedside.
Yeah, I get that.
And I don't get the sense from looking at his website or talking to him that much has changed as the individual patient would experience it. But if you go to his website, if you just Google Resolution Care, you're going to get the secondary, I don't even know what their name is, but the secondary
the
group,
entity,
they're the top Google hits. But if you persevere and go to Resolution Care of Humboldt County or something, then you'll get Michael's site.
Wow.
So I guess I want to ask this question. I think I started to ask it before. I mean, and correct me if I'm wrong in any part of this, okay? That when it comes to resources, when it comes to money, when it comes to muscle, the biggest player is Sutter. And I'm still a little bit unclear about what they could and should be doing about things like this.
Yeah.
As compared to leaving it to, these. I mean,
I get what you're saying.
Yeah, because they've got the juice to make things happen.
They're the institution here in Delaware County. This is a common thing. People know about a hospice and the need for end of life sort of things like this. And so is Sutter lifting finger one to deal with this need? Do you know?
No idea. They wouldn't. I wouldn't be in the know on that.
Yeah.
But
Is that what, I mean, you're asking just about, I mean, here's Sutter's the hospital of record here in Delaware County. What are they doing to address this common, like, need?
Well, yeah, I mean, I think there's that. And then for me, I kind of always keep going back to this whole thing of the community of benefit agreement, right? That, they made promises based upon them being allowed to be given nonprofit status. And Sutter makes gazillions and gazillions and gazillions of dollars. And I mean, I think it's great that, people like you were talking about are doing these great things. And it would be even greater if they had the institutional and financial support to be able to do those things and
scale up.
And do them, scale up to the necessary scale. And then also that if and when they have to go for whatever reason it may be, those services and the quality of those services continue to exist in the community. That's where I'm going.
I think you're assuming, and I don't know, and I could definitely be like completely off base with this, but I think Sutter exists in this community to funnel money to the Bay Area.
Well, yeah.
But, and so you're assuming that they're responsive to need in the community, and I haven't really seen that. So not
And also-
clearly, some ways maybe you could argue, well, there was a need for a hematologist, and now they have a hematologist. There was a need for an ENT, and now they have an ENT. So yeah, I think, but there was a need for a walk-in clinic, and the problem was not that they couldn't get it staffed. The problem was that they chose not to staff it. So, that I do know.
Well, and what gets okay, so palliative care. I have to think every time now before I say it. Palliative care, hospice. There are things that like Sutter and entities like Sutter, but here in Delaware County, it's Sutter and Sutter Health have been sort of legislatively like required to do, and that's to put money back into the community and to provide things that benefit the community, and that's great. That makes it sound like hey, we're going to have bake sales and and fun fairs and things, and it's just over. It seems like hospice should be part of just like your basic healthcare menu in a community and not something that's added on to their contractual presence here locally as a community benefit, like it's a fringe benefit they're giving us for, because we let them be a nonprofit.
Right. It should just be part of the deal.
I actually think that part of the problem might be, and this is more a general administrative problem and not just Sutter's problem, is that administrators don't understand why family practice people can't just do this.
Right.
And it sounds to them like we're just...
Is it also vice versa?
What?
Like do doctors not understand why administrative people can't just do this and get something done?
That's like a central battle every day. But,
Right.
But I think like when I was trying to get Resolution Care to come in for a couple of patients I had this year, it was kind of like there was resistance from administration because they said, "Oh, you can do all that." So no.
Wow. Well, yeah.
I can't. They really are so much more.
Yeah.
So, but Sutter does have a home health division of nurses. I don't know how functional they are because COVID, made life difficult for them, and they definitely kind of their presence was just lessened during COVID. But I would think that would be a good basis to, a foundational organizational thing where you could just kind of go from there. Like this Curry entity is a home health and hospice, and then same thing in Humboldt. They kind of do that. But I don't know why they wouldn't, unless it's really hard to staff. Because for hospice and for palliative care, you're really going to need a certain kind of provider and a certain kind of nurse. A lot of new graduates in nursing school don't rush to palliative care. You're treating people with complex and frustrating problems.
Right. That by definition you're going to lose.
Right.
Yeah.
Yeah. So you got to be kind of a Mother Teresa mindset.
Well, and I mean, this is probably way too big a thing to raise at this late hour in the show, but I mean, maybe what we really need is a whole sort of reorientation about how we think about death and dying, right? At least the other side of this, my understanding is that the vast majority of medical costs come in the last 6 months of people's lives. That's where the most money is spent when it comes to health care.
Right, and it's usually I would say through the ER from my day-to-day observations.
Right.
And I wonder if you're defined as hospice and you're not going through any kind of, treatment to prolong your life, you're just getting covered. Does that mean that that's the most cynical? That's a funding source that the ER is not bringing in anymore. That's interesting.
Yeah, I just, I think as a society, we don't deal well with death anyway.
Yeah.
And then, excuse me, it's a huge amount of money when it comes to the healthcare dollar in the last few months of a person's life. Right,
it is. And it's hard, and people don't want to be involved in it. Even family members, any kind of dual diagnosis going on in the patient is amplified with the dual diagnoses of everything that's around.
Yeah.
And it's just a really hard kind of medicine to do.
Well, Lynn, thank you very much for this. This is it's important and it's good to hear about. So yeah, we should get Dr. Is it Fratkin?
Michael
Dr.
Fratkin.
We should have him on sometime.
Yeah, I'll ask him.
Okay,
I'll invite him the next couple of weeks.
Any idea what's in store for next week?
I still like the idea of treating anxiety, but Mike comes up with good suggestions, so I'm always listening.
Don't.
That's Health Matters. Thank you very much. PA Lynn Szabo will be back next week.
Thanks.